In this video, I will be describing movement patterns and the planes and axes that they occur in. First, there's the shoulder joint. I'll be demonstrating abduction and adduction. Adduction occurs in the frontal plane and the sagittal axis. It occurs when I bring my arms away from my body. Adduction also occurs in the frontal plane and sagittal axis, and it's when I bring my arms towards my body. Next, there's the lumbar spine, which contains lateral flexion. It occurs in the frontal plane and the sagittal axis, and it moves laterally left and right. Moving to the shoulder girdle, I will demonstrate protraction and retraction. Protraction occurs in the transverse plane and vertical axis. It occurs when the scapula moves away from the spine. Retraction also happens in the transverse plane and vertical axis, and it occurs when the scapula moves towards the spine. Next, I'll demonstrate flexion and extension in the knee, both of which occur on the sagittal plane and the frontal axis. Flexion occurs by decreasing the angle of the leg with the heel moving towards the gluteus. Extension occurs by straightening or increasing the angle of the leg. Lastly, there's the hip, which involves lateral and medial rotation. Lateral rotation occurs on the transverse plane and vertical axis, and it happens when I rotate my thigh outwards so that my foot is moving towards my other foot. Medial rotation also occurs on the transverse plane and vertical axis. It occurs when I rotate my thigh inwards so my foot is moving away from my other foot. Lastly, I'll describe tensegrity. Also referred to as tensional integrity, it is the use of isolated components in compression inside a net of continuous tension. The compressed members do not touch each other, and the pre-stressed tension members delineate the system spatially.